What is ocular surface disease? Dry eye explained. Imagine your eyes as tiny, delicate ecosystems that need proper care to stay healthy and comfortable. Ocular surface disease is a group of conditions that affect the surface of your eyes, mainly the cornea and conjunctiva, which are the clear and white parts you see. These conditions can disrupt how your eyes function and cause symptoms like irritation, dryness, redness, blurred vision, pain, tearing, or even infections and damage to the cornea. One of the most common parts of ocular surface disease is dry eye syndrome. This happens when the tear film that covers your eyes becomes unstable or isn't enough to keep your eyes moist. The tear film is like a protective and nourishing layer made up of three parts: an oily layer from the meibomian glands in your eyelids, a watery layer from your lacrimal glands, and a mucin layer that helps spread the tears evenly. When any of these parts are disrupted, your eyes can feel dry, gritty, or like there's sand in them. You might also notice burning, redness, fluctuating vision, or increased sensitivity to light. Many factors can cause ocular surface disease. For example, if your tear production is low or the tears are of poor quality, dry eye develops. Dysfunction or inflammation of the eyelid glands, known as blepharitis, can interfere with the oily layer, making tears evaporate faster. Sometimes, the corneal surface doesn't heal properly because of nerve or stem cell issues. Chronic inflammation of the eye surface also plays a role. Risk factors include aging, especially after middle age, being female, living in dry or windy environments, smoking, autoimmune diseases like Sjogren's syndrome or rheumatoid arthritis, previous eye surgeries such as LASIK, certain medications, vitamin A deficiency, and skin conditions like rosacea. Symptoms can be quite bothersome. Many people feel a dry, gritty sensation or like there's sand in their eyes. Burning, stinging, redness, and blurred vision are common. Sometimes, paradoxically, the eyes tear excessively because they are trying to compensate for dryness. Light sensitivity and difficulty wearing contact lenses are also typical. These symptoms tend to worsen with activities that reduce blinking, like reading or working on a computer, especially toward the end of the day. Diagnosing ocular surface disease involves a thorough exam. Eye care professionals may measure tear production with tests like the Schirmer test, evaluate tear quality, check for damage to the eye surface, and assess eyelid gland function. This helps determine the specific cause and severity of the condition. Treatment is tailored to each person's needs. Artificial tears and lubricating eye drops are often the first step to supplement the natural tears. Managing inflammation with topical anti-inflammatory medications can help reduce irritation. Addressing eyelid gland issues through warm compresses, lid hygiene, or specialized treatments can improve tear quality. In more advanced cases, procedures like punctal plugs, which block tear drainage to keep tears on the eye longer, or other surgical options, may be recommended. Since ocular surface disease can overlap with other conditions like glaucoma or macular degeneration, it's important to have a personalized assessment and ongoing care from health professionals. Proper management not only relieves discomfort but also protects your vision and improves your quality of life. In summary, ocular surface disease is a complex condition that mainly involves dry eye syndrome and related disorders affecting the tear film and a surface. It requires careful diagnosis and individualized treatment to keep your eyes comfortable, healthy, and seeing clearly. If you experience persistent eye discomfort or vision changes, consulting an eye care specialist is always the best step to find the right solution for your eye health.